Hello, my name is Jocelyn Zavala Garcia. I am a sophomore nursing student at the Ann Louise Fitzpatrick College of Nursing at Villanova, and my research project is titled Establishment of a Community-Based Participatory Research Program to Assess Community-Led Exposure Risk. I work closely with Dr. Daniel Smith from the Department of Nursing at Villanova, as well as my co-authors. So to begin, lead is an environmental contaminant. It is a toxic heavy metal, and it disproportionately impacts communities of color across the USA. It has huge implications on people of all ages, especially children, since they are still rapidly developing, so they are at risk for behavioral, intellectual, and cognitive problems as lead heavily damages the central nervous system, and adults can experience fertility problems and also memory loss, to name a few. So we established a community-based participatory research program in Norristown, Pennsylvania, which is a primarily Latinx area near Villanova. We partnered with Sagate, a nonprofit organization in Norristown. We conducted 4 focus groups there with a semi-structured interview guide. We conducted the interviews in Spanish, and then through the focus groups, we recorded them, we transcribed them, and open-coded them to identify the community's research priorities. So we used thematic analysis, and we found 4 key themes, which were sources of contamination, lack of information surrounding lead, institutions ignoring health and safety, and financial implications. So participants identified lead contamination through their pipes, their water supplies, their paint, and their soil as well. They spoke of the lack of access to information in Spanish, especially because some people in the community spoke and understood more in Spanish, and some understood stuff better when it was spoken to them in English. They did not know all of the symptoms associated with lead contamination. They did not know how to change filters, which clinics to go to if they wanted a lead test done, or if they were undocumented, they did not know which clinics would accept them. They also gave personal experiences as to how institutions were ignoring their health and safety. So they said that sometimes their employers would only give them masks and goggles during inspections, and when there were no inspections, they were not given those masks and goggles, so they were at an increased risk for inhaling, ingesting, and coming into contact with the lead-based particles. The community was not aware of all of the historically contaminated sites in Norristown, and lead exposure tests were not being conducted in all pediatric centers or health centers. So at times they were given the option to, and at times they were not. For financial implications, the community spoke about the accumulated expenses from having to constantly buy bottled waters from the fear of lead contaminated water or knowing that they had lead contaminated water. They also feared being seen as complainers by people if they spoke out about the unsafe conditions they were experiencing in their homes or in their jobs, and they feared losing their source of income or losing their home, especially with the scarcity of houses and the expenses associated with having to move if they had to move. So all in all, these 4 key themes helped us establish the research priorities, which were to utilize multiple lead exposure assessment methods to determine the community's lead exposure, risk for lead exposure. And we would do this by testing their household water supply, household paint supply, and also their soil, along with their blood lead levels through blood lead testing, so that we can determine their own personal blood lead levels. All in all, also providing this information in Spanish and English so that they can understand it in whichever language they prefer. So from here, the next steps are to conduct these lead exposure assessment methods and to disseminate back the results to the Latinx community of Norristown, Pennsylvania. Thank you.